Hannah Eisner,
Here.
Corey Tello,
Here.
Judy Buchanan,
Here.
Susan Schaefer,
Here.
and Carla Pohl.
Carla, let me know that she would not be able to attend this morning. So why don't we go ahead? We have two items on the agenda. One is approval of the minutes. Let's go ahead and do that, and then we can discuss how we want to proceed from there. So do I have a motion for approval of the minutes? Let's see. I don't have my
I so move. I so move.
second. Second?
Oh, second.
Okay, any discussion?
Second.
Okay. Any discussion? Any corrections? Okay. All in favor, say aye. Oh, wait, sorry.
One question.
Okay.
It may be something I missed. I know the discussion item of multi-year contracts was in our minutes. We have not moved on that. Is that correct? We're still in some discussion phase.
Yes.
Okay, very good. Thank you.
Any other questions, comments? No? All right, all in favor of approving the minutes, say aye.
Aye.
Or do we need to do a roll call?
Yep.
Amy, would you please do a roll call on the approval of the minutes? And I don't have the agenda open, so the date is for, was it August 23rd?
The date of the minutes was August 3rd. August 3rd.
August of 2020.
Right.
Amy, you want to do a roll call vote for us, please?
Sorry, I was doing it. I was just on mute. Sorry. So we had Corey that was, Corey motion to move it. Judy seconded. Hannah Eisner
Yes.
and Susan Schaefer.
Yes.
And Corey and Susan, Judy should vote.
Oh, I'm sorry. Corey Tello
Yes.
and Judy Buchanan.
Yes.
Great, thank you. Okay, so Susan, before you got in, there was a question raised about whether this was an open or closed meeting. And I said I had not, and I think we've discussed this in the past. This is not posted as in a closed meeting. So we could not proceed today if the members are preferring. One, I would say we need to get a clear opinion from our legal department whether it would be appropriate to close the meeting to discuss these applications. And then we'd have to, of course, reconvene to do that under a proper notice. And by my way of thinking, my 2 cents worth is, at this point, all the applications have been submitted, so nobody can come back and adjust theirs based on what others have submitted. And so if there's a concern about people having some insight into what others might be requesting, that's done. I would expect us to be talking more about our scoring and opinions as to priorities and such, which I would think would have to be done in open session, but I'll open it up to anybody now to discuss. Yes, Judy.
Yeah, I agree. However, part of our discussion today, as I understand it, and correct me if that's my understanding is not correct, we will be arriving at some recommendations to present to the board. And my question was, if there are members of the public or agency people observing this, they're going to get a heads up before the board even has a chance to vote on the approval of our recommendations. And quite honestly, I can't remember how we've handled it in the past.
Okay.
Last year was the same situation where the Mental Health Advisory Board had the discussions and then made their recommendations and then moved it to the Board of Health. Because if you guys remember correctly too, just real quickly, that when we had the the little groups that we were trying to do last year, like the 3 members, Trevor did look into even trying to, if it was appropriate for those to be closed groups or closed meetings. And last year he came back and said it had to be open meeting.
Okay, so I think
It was open. It was open last year because I do remember we had some agency people attended it because that was when we met. Like, you remember those days when we actually met in person? Yes. And so agency people were present. So
Okay.
we did
And-
have.
Any thoughts?
And the fact that,
Susan, go ahead.
that these are just recommendations to the Board of Health. The Board of Health can still, as a whole,
Right.
make changes to these recommendations. So
No, I appreciate the discussion. Thank you. And I'm fine with us proceeding.
Okay, all right. Okay, and I think, you know, so we have about a couple hours to get some work done on this. Hopefully we can get to a decision today, but if we can't, then I talked to Amy and I think we could still continue this discussion into November and be okay. But, you know, our goal should be at least to try to get to decisions. First of all, I just want to make a couple introductory comments and then I think we'll move on. One is, thank you, Amy, for the spreadsheet with the applications and the asks in the previous year's data. That's very helpful to us. And of course, it shows, unfortunately, that we have about, let me get this back up here, about a $1.2 million gap now in our ask and what we have budgeted.
Mhm.
So our job today is we take applications for programs, all of which are worthy of funding. I mean, the difficulty with this every year is I think we understand the value of each and every one of these programs. And, you know, it's very hard to think that we might not fund or not fund fully a program. But that's the hard decisions we're faced with today, obviously, and particularly with that much of a difference in the ask and then the available funds. Now that assumes that we are putting $50,000 aside for more work on the piece that Corey and her group are working on now in terms of community awareness programming, et cetera. And that we have 209,000 and some change for drug court already budgeted. So we've already approved the health department budget with this $1.4 million figure. Let's see if I can pull that up.
Now,
So, yeah, go ahead, Judy.
the $50,000, I thought that was it was in last year's budget. Do we have to now move it to this one? Is that? Because
No.
it's the amount of money, it was unused from last year. Is that not correct?
Well, my understanding is that we have recommended a budget for 2021 that would include $50,000. So it's 601. I mean, it's money. So the 1.4 million what we're using for mental health grants, and that does that we have taken the total, which would be 1 point whatever 5, and we've taken 209 out for the drug court and 50,000 out for this other program. So it doesn't move.
1.4 is what we are working with.
Right.
So yeah,
Right.
so the 50,000's already been taken out of that, Judy, if that was your question.
I mean, I know it's confusing because we really didn't use it this year. So when we look at our expenditures for this year, and we may hopefully use some of it yet,
Right. There's some hope that we could use some before the end of the year. Yes.
our budget next year also includes that 50,000 again to continue that work or to get it off the ground if the case may be. So, you know, there has been talk in the past and we have not put on our agenda any discussion of whether we should look at increasing the overall budget for these grants and using more fund balance. So I think that's a discussion and we may be finding ourselves in after we go through the review of the applications.
Just to clarify real quickly, it's 1.14.
Good,
Oh,
thank you.
Sorry,
Yeah,
I
I just
misspoke.
don't want it to look like there was 300 extra $1,000. It's
Yes,
1.
Thank you so much. I'm so sorry I misspoke. That's an important error.
Yes,
I
Susan.
like the first figure better, but it wasn't reflected here.
Yeah.
could I ask for everybody to mute their microphones if they're not talking? Because I'm getting feedback on this. So thank you.
Okay, so what I am suggesting maybe as a beginning point is maybe we can each take a turn, just, like our debates with the presidential thing, you're 2 minutes uninterrupted, haha, right? Is to first, I think there may be programs we have some consensus on whether this is the right time and place to fund them. So I thought maybe we could all, if we have any programs like that on our list, identify those and see if we have any consensus on that. And then secondly, maybe we can each go through our own evaluations of the grants. The problem with the scoring, it's not a problem, is that these are sometimes apples and oranges. So I'm more concerned about how we compare similar programs on the scores and how maybe different types of programs are scored. But let's, I think maybe, does that make sense to you? I'm open to suggestion on how you want to proceed, but I thought first, maybe if there are some we just feel we can't fund at all, let's go through those that may get us somewhere with the funding, and then past that, a second round of, is this a time when this particular program may not be funded, or obviously the budgets are going to be an issue. So Susan, I know you have a 1 o'clock, so do you want to start?
Do you want me to tell you what I think we should fund? Or what I think are certain ones that, which way?
You're muted, Hannah.
Yeah, I mean, I thought probably it's more efficient for us to go through everybody to talk about both programs they think should not be funded at all. And then obviously within those that you think maybe the priority programs that you would see would get priority over others. Clearly we're going to end up looking at budgets, but let's start there.
Okay, my priority programs that I definitely strongly support funding is the crisis 211 call center, which includes an increase from the past, but I think because that was the texting edition, and I think that we've talked about that for many years, that's needed piece of that. The other one that I have is, to me, critical that should be funded is the mobile crisis unit. And then I have, excuse me, on here, psychiatric services from CHS. However, I don't agree with the number. So those were the ones that I have prioritized as ones that to me are most critical. And I guess that since we didn't see the other comments from everybody, where everybody wrote comments, and in the past we had comments, to be able to maybe evaluate things that we're not thinking of and somebody else's ideas or comments on it. So we didn't have that this year to be able to look at. But on the embedded schools, personally, I don't think that we have the funds to really increase what we're doing. However, I'm going backwards. I'm going with, finding out how much money I have left then, kind of thing, as to what to fund. I'm not sure about increasing the number of schools, even though we know that that's going to be a very high priority item once the kids go back and become in person. So I'm kind of concerned about that. I'd like the eating disorders, but I'm not sure that this is the time to do the eating disorders. And I think that there might be some ways that we can help that, maybe be directed to a different area in the community. Even though it is somewhat of a mental health issue, I don't think that this is quite the right time with COVID to start that. So I guess that's kind of where I'm at right now. Second time around, I might have more to say.
Okay, and yeah, and as far as the comments, I was assuming that we would be sharing those today. So, so feel free to add. I noticed you didn't weigh in on all of the applications, so you're just holding out and seeing what other people say on those.
Well, like I said, I kind of was taking the money and going backwards. And so I like the idea of continuing with Ending the Silence program. I'm not sure about the substance use prevention. I had some questions on that in my comments that I wrote in my notes on how that was going to work and how well it's been working. Which is unfortunate. We can't have some of these in-person meetings because we get a lot of information from that.
It's okay. Go ahead with your comments now, Susan. I mean, if you had issues on the substance use, what were your thoughts?
On what?
Go ahead and share your comments with us. You said you had some comments on the substance use abuse program for us.
Yeah, I can't remember if there are different schools that were doing this or a lot of schools dropped doing this, and the effectiveness of the online portion of it. That was, part of my questions, concerns on that one. So that and unless we had Project Oz here to answer that question, it's, I don't know what Amy knows about that. Let's see what else. Oh, on the target case management for individuals in crisis, to me, that is somewhat of a duplication of the mobile crisis and the Fuse project. So it kind of was not in favor of that one. The adult psychiatry from Chestnut was an incomplete application, so I didn't even look at that after I realized that. So the baby fold, I like the idea of the early intervention. So that's where I'm kind of torn when I'm looking at, what to eliminate, what to not fund, and which our priority should be. So I like the early intervention of it, but could for a year not be funded? I don't know.
So Susan, when you talked about the top ones, the crisis, the path, I'll call it, mobile crisis, psych, CHS, and embedded schools, were you doing the number crunching there to say that, except for maybe the embedded schools, we would be able to, or your thought would be to fund those at the requested amounts? Or
No.
not psych, but you were saying.
Not the psych. The requested amounts for 211 and mobile crisis, yes,
Okay.
but not necessarily for the psych portion.
Okay.
Because otherwise, I mean, when you look at it, if you did the psych portion and the mobile crisis, there'd only be $200,000 left to fund anything else, and so that's part of the reason there.
Okay, you ready
And
for
we passed
to
my
move
2
on?
minutes.
Okay, who wants to go next? Corey or Judy?
Yep. First of all, I agree. My top priority would have been the call center, and I am very supportive of the increase. I think they need the new staff person, and they need that person to help with the texting. It's been something that as Susan alluded to, we've talked about. And the mobile crisis, as it's presented from CHS, I am supportive of that amount. So those two amounts I'm very supportive of. I have shown that in my work, in terms of embedded schools, Irving and Sheridan, which would be new, I'm suggesting we include them, and Evans Junior High and Ridge Elementary, and that we consider, as we look at funding and totals, by my calculations, what I have chosen, there is not money for the Olympia or the Parkside Junior High School. So that, just weighing in on that. I do have questions about the Fairview and Sugar Creek School of Chestnut. And the $62,000, I can direct this to Amy, that is for staff to be within the school for a full year. Is that correct?
That is correct for Chestnut. That would be 62,000, or that's for the year of 2001 calendar year.
Now, and last year it was $20,000, and that would suggest that they were not staffed within the school. They were embedded last year, even
So
though
so for 2020, for this year, are you talking about this year, Judy?
Mhm.
No, you're fine. For 2020, they are in the two elementary schools.
Mhm. Mhm.
And they haven't utilized.
Can I follow up on your question, Judy? But they're asking for the same amount of time. The person going into Fairview and Sheridan this year is not going in any more time than they did last year, correct?
Well,
I mean, it's the same,
Correct.
it's the same
Yeah, it's
position
the
as,
same program.
yeah, so I'm not sure why the difference between 20,000 to suddenly 62, because they're saying they can't generate fee for service. And all the other schools are generating fee for service. So it's very confusing and it doesn't comport with an equity of cost for the
Well,
other school programs.
Yeah, that was exactly what I was looking at. And others are able, as you say, to bill. So that is one that I believe the figures and the demographics would suggest is a good choice, but certainly not at the $62,000. And I really did take a look at the Illinois report card in terms of identifying. I tried to prioritize the level of income in terms of the students that might be most in need, with families, particularly right now, struggling even more. And that's where I came down with the addition of these two new elementary schools.
So you're saying Irving and Sheridan, right? Judy, is what you mean, Irving and Sheridan?
Yes,
Yeah,
exactly. And Evans and Cedar Ridge. Mhm. And I, like the others have, feel that the eating disorder services, obviously that is an issue, and it is real, and it certainly does impact people. Unfortunately, at this time, if we look at prioritizing the greater good for the greater number, I don't see any way that we can fund that, and would suggest that they consider to look at how they can do it, and maybe work with another agency that is more of an interrelated that they could fit into. I am supportive of both the youth services programs that Project Oz is applying for, both ending the silence and the substance abuse. While I appreciate the Healthy Start, a phenomenal program provided by the Baby Fold with a long, successful history, they may be in a position more so than others to draw upon some of their own resources. And I right now, I'm not able to support their request for $90,000.
So just Judy, to clarify, are you saying that that would be a program you would not want to use our funds for at all this year?
Are you talking about our reserve funds?
No, I'm talking about the 1.14 that we have. You would your recommendation or thought is that the Healthy Start could be funded at 0 this year.
Oh, no, it could be funded at 75. I'm sorry. No. Just continue the same level of funding. No, I think
Okay.
that's very important. We have talked as a board and as a group interested in behavioral health about the importance of the younger you are working with the family and their children, the better the outcome is projected to be. So I in no way do not want to fund it. It's just not at the $90,000 if we're going to look at some of the other needs that are here on our document.
Yeah, I just wanted to clarify that because I wasn't hearing that. So
Okay, I'm
thank you
sorry.
for,
Mhm.
anything else that at this point you want to add, Judy?
No, just 20,000 for Fairview and Sugar Creek as before. I agree that the adult psychiatry proposal submitted by Chestnut was not complete, and therefore we're not able to consider it at this time. And psychiatric services, obviously, we have to have that kind of follow-up and availability in our community. Like a comment before, I think we're going to have to look at the amount that's been requested and some of the ability we might have to provide that amount of funding, which is equivalent to almost half of what we have available.
Are you ready for Corey to
Yes.
begin?
Fine.
Or
Yeah.
Corey?
Okay, I'm going to start with the ones that I believe that I can take off the table. And that would be, of course, the one that was incomplete, the adult services one that was incomplete, submitted by Chestnut. So I would say that we cannot consider that. I would also say that the 2 eating disorder programs from One Hope, again, I think this is a legitimate concern. I'm glad they've raised the awareness of it. I think our role, however, for this year can be not to fund it, but to perhaps, like we talked earlier, to figure out how to help them perhaps find other stakeholders interested in this and that have a common mission, and perhaps figure out a way to do some sort of a blended project, but a standalone for us for that is just not viable for this year with all of the other needs. Again, certainly worthy of consideration as a need for this community, however. I also would consider right now the, well, and I should also say I cannot weigh in on Babyfold because I have a conflict of interest. I'm on their board. So unfortunately, I cannot say all the things I would like to say about Babyfold. And then the other thing that I would take off the table for right now is Chestnut's targeted case management. Again, I appreciate that for the people that go to the crisis stabilization unit, to have follow-up case management is very appropriate, very, very solid, very good idea. But I think until we have kind of thought through case management, because again, all of our hope through the McLean County Mental Health Action Plan and all of the work of the Mental Health Advisory Board and the 553 Board is to talk about coordination and collaboration. And we have some case management available in other ways. And I think before we add anything else, we would need to once again bring all of the case management players together and try to really map out how to send those services and really think about coordination of doing that. So in other words, build a system of case management that meets all people who have a case management need, not just the ones that go to the crisis stabilization unit. So those are my, I think I'm done with that. Then as far as the embedded schools, I there are, again, so many worthy situations, and we've said all along, wouldn't it be great if we could have an embedded therapist in every entity in the county? I would say we fund some of them. I won't talk right now about what order, but we clearly cannot fund all of the requests we had. So I would agree that we probably should try to stick with funding in the amount we funded last year, if we can even do that many. And I believe that was 5 different entities. So if we could do 5 of the ones that were for consideration. And I will say that a new addition of Irving and Sheridan, I think that does appear to be just 2 schools that we know have for a long time have had significant needs. And we really need to, I think about that one. We also really need to think about how we would blend any services that are going into schools. I think, again, and I would throw this over to you, Amy, is that I think in our contracts with people, if they are working in a building where there is another kind of a macro level service coming in from an outside entity, I think we need to put in our contract that there is some way to track that they communicate and coordinate with each other, so that, again, that all those services we are being maximally efficient and effective. And that can only be done if people are sitting down together and saying, how are we doing? How are we dividing up this work? How are we maximizing each other's efforts? And how are we avoiding any duplication unless it's something that it should be done together. So I think we need to really push that. We talk about it all the time, and I think we need to codify it as best we can. So the ones I know I feel like we absolutely have to fund for this health and safety of our county is Crisis 211. We have to have a way into our systems. We have to protect people that need support, and PATH does amazing work in terms of all of the after hours supports they are to agencies that are critical agencies. And so the call center 211, we have to fund mobile crisis. We have to fund psychiatric services, adult psychiatric services. And again, that definitely is Center for Human Services, since we've taken the other one off the table. And I will note that ending the silence is something that because it reaches every single school in the county, and it is about suicide prevention. That's a pretty hard one to let go of, because I think as all of these entities do, that it saves lives. That probably saves lives in the most direct way, by helping direct people to supports. And again, what I am very impressed about that is a great model of collaboration and coordination, because before they go in to do a presentation in the school, they've coordinated with the crisis team, they've coordinated with the school counselors, they've coordinated with Center for Human Service and embedded therapists and others to make sure that if students, after hearing that presentation, have a need, they are all lined up with very ready to be responsive to anybody that comes forward and says, based on what I heard today, I know I need help, or my friend needs help. So I celebrate that collaborative effort. And I did want to point out, I think I'm going to stop there, because this is very hard. This is like choosing between your daughter or your son. It's so hard. I will say, I just want to make a point about the Oz prevention education, that if reading carefully, what they are asking for is funding for the schools, because again, they have another funder that So about half is from us and about half is from their other funder. And they set it up to be in compliance or in sync with the McLean County Mental Health Action Plan and our goals, which have been to say that we should look at those zip codes that are most impacted based on the community health needs assessment. And so if you have read this carefully, you will see that the funding that they are asking for funds those prevention services at Chittix Junior High, Bloomington Junior High, Ridgeview, Lexington, and Leroy. And those are, so it serves both rural and zip codes that we've highlighted as significant needs. So just a point to note. And I think I'm going to stop there.
Thanks, everybody. Amy, I have a question for you, and Judy, just hang on one second. The document you sent us is in a Word form, this listing of is that also a spreadsheet? It would be helpful, I think, to have some sort of spreadsheet go on here. As we start to talk, I was trying to make some notes of, where we stand dollar-wise. Is that do you have one, Susan?
I don't have a spreadsheet, but I've been kind of doing some math while everybody else has been talking after I got done talking. And
Okay, good. So you're the math person then? And let me make my way in and then we can go from there. But if
okay,
you wouldn't mind, that would be
Okay.
great. Because I was trying to do notes, number crunch too. So Judy, you had a question.
And the question, Chestnut's applying for school-based services at Fairview and Sugar Creek when in fact it was embedded last year. Was that an upgrade or a switch in the level of support or services that we recommended? Or is this something that Chestnut has concluded would be a good idea for the best? Amy, what have I missed?
What was your question again, Judy, as far as about chestnuts? Yes, they are Cedar Creek and Cedar and Sugar right now.
They have opted to refer to it as school-based services where they're going to place staff in the school rather than embedded as had been the service last year. And I am just interested in that change or that upgraded level of support. That's
So
some, what is that?
it's not an upgraded level of support. I think it's just that that's the terminology that Chestnut uses for embedded school project versus the Board of Health uses embedded school. So they call it, Chestnut uses the terminology school-based, but the clinician this year for 2020, it's the same, they're asking to fund the same program that is this year in 2020 going into 2021.
And so why the difference in the level of funding? They're looking at the same program, the same kind of services, albeit calling it different. What is the reason, or do we know, for the additional dollars being requested?
I didn't, unless someone else saw documentation, when I reviewed their proposal, I didn't see any documentation on the increase other than it's a new program and that they're concerned that they won't be able to make up the difference in the fee for services. And also, just as a side note, that program did start this year in 2020. And the program that we discussed that started April 1st instead of January 1st. And also that therapist is resigning this month. And so they will have to replace that therapist. So in quarter two, I don't have quarter three numbers yet, but in quarter two, they've served a total of 10 people. Or between quarter one and quarter two, they've only served 10 people total. So they have.
You did give us that update. That's very good.
Yes, and they've only, as of the end of August, they only used $6,000 out of the $20,000.
Okay.
So I'm not sure why there is an increase in asking for money when they may not be able to use the total funding this year at $20,000.
Judy, Amy, is it fair to say that program simply never got off the ground? And part of it, to be fair, was because it went, they had trouble finding a therapist, then getting the therapist onboarded and trained. By the time they did that, that's right around when COVID was hitting. So it was very hard for that person to establish relationships in the schools because they couldn't be together in person. And so trying to establish relationships, not only with the staff, but also with students and families remotely was difficult. But but unfortunately, they didn't seem to find an avenue through the difficulty. And so basically, we paid for a service that was not delivered in full. So that's why I'm really reluctant to think about doing that again, especially when they're saying that they don't believe they're going to have the volume to generate fee for service, or that's the difference. In the only explanation I could glean from reading it is that they're asking for $40,000 more than every other school program, because they're saying they can't rely on fee for service, and that does not. So if I'm missing something, we're going to have to reach out for clarification, but it does not make sense to me that we would fund something that is 3 times the cost of everything else we're looking at.
And I agree, Corey, and that was part of the reason I started this discussion. Okay, thank you.
And Corey, you are correct that I would agree that the program hasn't really been implemented. And so it's hard to think about sustainability when something hasn't yet been implemented.
And then also to request, with that fact being known, to request such an increase, it's difficult to follow.
And just to be clear, and I'm sorry, this is raising other questions. They are present in the other schools, are they not? Chestnut, they have embedded counselors in other schools?
Through the Board of Health, they're not funded in any other schools for 2020.
But I think
They're in Ridgeview, correct? I believe they're in Ridgeview, right?
I don't keep up with it as far as the other schools. They do have school-based services like what Judy was discussing, but I don't know the restrictions or limitations, or if there's funding through the schools. I don't know how all of that works. They do have school-based services in other schools, including I think Ridgeview, but I don't know how the system works, or if it is access to all students or just based off of Medicaid. I don't know all of that information.
Okay, thanks. And let's kind of keep forward going and not get too mired down in the Chestnut. I don't know, Susan, if that was your comment on that particular application, or.
No, I was going to ask you to give your opinion so that I can do math while you're talking.
Right, thank you. So I guess it's one of the nice things is I think that we're all on the same page with the 211 proposal and the crisis, and certainly in terms of programs that we need to fund our psych. But for your purposes, Susan, I agree that the 2 proposals for the eating disorders are they're not the right year for that. And I think we just say no to them. Good idea. I think a lot of people said the same things I thought of. These seem to be something that maybe they do more advocacy rather than creating a whole new standalone. They kept saying it's a standalone agency for this specific issue. And I would think before you do that, you ought to look to see whether some of the other providers need some assistance or could add it with some advocacy on their part. So I don't support funding either the adult or the youth, one of those. And now I'm losing my notes here. And I agree that the Chestnut application for psychiatric, I scored it because everything else was there, but it's still, and looking at scoring the 2 psychiatric programs, certainly CHS got the higher score. So I would say that it seems to me they're in the same position they were last year. I don't see that they've indicated they have access to or a way of providing that psychiatric care at this point in time. And we certainly know, I'm beginning to really appreciate the fact that CHS has a rare commodity and that they actually have a real life psychiatrist there. Since it seems even our attempt at doing telepsych is proving to be very difficult. So I think with that too, since CHS seems to be the one source of psychiatric care, particularly for low-income people, we absolutely clearly need to support that. And my first reaction was, no, I don't want to increase the amount, but I'm not sure where I stand on that. The other programs, what I tried to do is think about what we're doing in the next year. These are 1-year grants. And so I'm share with Susan a little bit of the thought that maybe the substance abuse programming that Project Oz could stand a year without our support. And I say that because they go back to other grades. So if they missed a year, if it were to pick up again next year, those kids would get it. They just would miss a year of it because it's a multi-year. They hit them 2 times during their school. And they had a lot in the application about the fidelity to this national curriculum of just say no, too good for drugs. They have some, when they discuss, and this is my concern in terms of a lot of the school-based or home-based programming this year with the COVID limitations. They said at one point they had it broken down for a 20-minute segment that they could have kids take it home. And yet other parts of the program talk about the importance of the breakouts and the small group sessions. So I don't feel like I have enough to understand that they could successfully deliver the program under these circumstances, which is not their fault, but just reality. And we may need to use those funds for other more immediate needs this year. So again, I keeping myself saying it's a 1-year proposition. And I know that losing funding for a year, I don't know that the program would be lost forever. They have funding from IDHS still. It might be scaled back. Maybe they do more through the 20 minutes without going out, or, I don't know. But so I put that one on a possibly not to fund list. I don't feel the same about the Ending the Silence. I think that ties in a lot with mental health, and I'm convinced that, if you can get kids to talk about that and locate them, then that's important. The Chestnut targeted case management, I'll admit I think the group is consensus seems to be more, it's probably duplicative of some other programs, although it is certainly targeted to the CRU. My thinking on it is, if you have more case management there, do you have less crisis to deal with after the fact? So, but I agree with, I think, Corey, your comment of saying, we really need to, and we've been trying to do that, is look at how all these different pieces from the 211 to the mobile crisis unit to now triage and fuse work, and get a better picture of whether we need to fund additional crisis services. So I am okay with saying that's a program that should not get funding this year, but one to look at for future years. So I don't know, Susan, if you take out the Chestnut Psych, the eating disorder, and the targeted case management, how do we look on that, Susan?
Okay, so if you're talking of funding, with what you just said, with funding psych at 551 and crisis at 384 and 211 at 287. If you're talking about that, that leaves 115,000 for anything else, which is probably pretty much eaten up by Ending the Silence.
And
there's
I
said-
no schools, that would be no embedded school funding at all on that. So that's why, those were the numbers I'm working on here.
Susan,
And
did you say 287 for PATH or 87?
87.
It's 8. Okay, good. Thank you.
And thank you, Susan. And I'm not, as I said, I'm not completely committed to giving the additional monies to CHS. I will say that I am getting tired of applications from them, and the embedded school also contained that we can't do it without your money, without any sort of indication that they were willing to do fundraising or anything to sort of support funds from other sources. So if the 550 is just, we don't want to use our reserves and we're going to put it on you, I certainly don't support that. I mean, I think we ought to be expecting more coverage if we give them more money. So, you know, I'm be happy to say what our last year's amount was, which was, I think, 434 or something like that. So
It's 400.
400.
just 4.
So with that number, that changes things, because then if you use 400 and the crisis, mobile crisis and the path, then we end up with 270, 874 to distribute between everything else. So I was just finishing the math on if we fund ending the silence, because I think that was a consensus that everybody thought should be there. You're right around 200,000 left on whether it's Healthy Start or any of the embedded schools or the Project Oz. So we know that we're not going to be able to fund all of that with that. So I guess we're going to have to prioritize those remaining programs.
One of the things I didn't mention is on the Healthy Start program, and many of these, as I said, I was concerned about what we're looking at for this year with COVID, and it seemed to me in the narrative on the Healthy Start, there was an indication that the guidance they're receiving now is that they should do most of what they do virtually. And correct me if I'm reading the app wrong. This is how I read it. And there was some thought that hopefully their clients have the platforms to do it that way. And I was a little concerned that there wasn't more either dollars in there to provide equipment to clients to ensure that they do. There was a reference to the school districts giving kids tablets. But I don't know, some of these clients, I assume, do not have school-age kids yet because they start so young, that I just really was not clear on how they were going to actually successfully deliver the service in this environment. Again, a horrible place to be, but so I don't know if anybody had any thoughts on that. And I'm sorry, Corey, I know you do, but kind of.
I'll just say in general, some things some services across all entities are delivered via phone. A lot of things is done by phone because just about everybody has a phone.
Yeah, go ahead, Susan.
My initial, when I first ran through this, I had kind of hinted at keeping the Healthy Start funded at 75 from the same as they got this year. Because it is the prevention part of it. And I know the health department also is focused on prevention instead of waiting till, you know, they're already into the systems of different kinds. So that was, I guess, my thought initially on Healthy Start. So and I also agree with you, Hannah, on that, what you said about CHS and the, you know, increase in funding. That's why in my mind and my calculations when I was going through these is to leave them at the 400 that they got last year.
And just as a real quick update too, we do have Jeff, my office support specialist, using that Excel document that he created. I didn't, that he created. We do have like the running numbers. So just to real quickly go through what we have so far per discussion: 75,000 for Healthy Start, 87,000 plus, or around 87 for 211. And then he has it as 98 if we do the Project Oz substance abuse. NAMI at 70,000. 123, mobile crisis unit at the 384, psychiatric services, if you do it at 400,000. And then that's what we have so far. And that would leave us 27,000.
And that 27,000 would be for the embedded school projects.
No.
None of them.
No, did you include the tally you just didn't include embedded schools, did it?
No, it included, you guys have gone back and forth on substance use prevention. So it did include the 98,000 for substance use prevention. But no, the 27,000 less does not include embedded schools. Or 27,000 left, I'm sorry.
Yeah, Judy.
No, I think the suggestion was offered that the substance use prevention, albeit a very good program with a good history, that might well be something that could be done on an every other year basis and still not diminish its impact. So I, for one, have kind of circled that as one that we maybe will find that we don't need to fund this year and not hurt the overall picture too badly.
Corey.
Sorry, I'm going to throw a clinker in that. And it's just a piece of information we should consider. That program is based on a model that, again, they try very hard to have fidelity to the model, and that's why they've had such good outcomes. It has to be delivered to stay true to the model. It has to be delivered 2 consecutive years in a row, because they believe then when students get it 2 years in a row, it kind of cements the concepts, the coping skills, the, being able to say no, et cetera, into that. So that, I don't think they could do it every other year because it would break fidelity to the model.
Thank you.
And those 2 years have to be consecutive. So that's,
But Corey,
and so
I'm
I'm just sharing that information. I think
but
we
let
have
me
to
ask
be careful. I think we have to be careful when we say, let's just change something that we are not, we talk so much about evidence-based and making sure we're encouraging people to use evidence-based programs. And so then anything we do, if it destroys the evidence base of what they do, then we might as well not do it. And so again, just a piece of information that I think, have to consider. And, but I also agree that I understand that it must be very hard to deliver that model with integrity right now, having to already have to adapt it to a remote and a smaller time segment option. So, I mean, that might be something we have to consider globally, but I just wanted you to know that we can't tell them to go every other year and then think that they can still be true to their evidence base.
Thank you.
and I appreciate that comment, Corey. And I think you hit on what I was going to say. I don't know that I could read in their application and suspect that by doing it, some in class, some not, some remote, some virtually, some not, some sending modules home with kids, that they've already kind of lost some of what they had, unless they can provide us something that the national group has come up with a method. But appreciate your comment that, yeah, we can't just presume to know, oh yeah, you can just do it this way or that way. I still feel that in order to meet the needs this year, that program, could be one that we would not fund. So Amy, so you, without the, and I don't know if you can share screen or whatever on the spreadsheet, but the tally you did not include any embedded schools funding, and it did include the substance abuse. There we go. Great. Thank you.
That is correct, Hannah. And then we did take off Project Oz, knowing it's still in discussion, but for the purpose of discussion, we did take that off as of now. And the remaining is 125, 740, 43.
Okay.
Do you to click on this? Make this bigger?
Hannah, can I ask a question or a comment?
Yeah.
Okay, so should we, I appreciate, I mean, I'm glad we kind of pared down some ones right off the top that we kind of are comfortable with. But should we now, before we go farther, should we talk about whether our approach from here out should be looking at reducing amounts on the ones we do want to fund, freeing up some monies to be able to keep more of them in play? Or do we do, again, we realize that, you know, these represent salaries and so positions, and sometimes you can't, hiring a quarter of a position isn't going to do you any good. So I'll get back to my question. My question is, should we look, before we go too much farther, at seeing if we can look at giving certain agencies, fund them, but at a less amount, and see how many of them we think we could do that and keep their services viable? And or should we also look at whether we should think about going into our reserves anymore? And if so, to what degree would that be? Or, you know, that's, I mean, I guess I'm just trying to say, does that make more sense than to say, you know, we're just eliminating a whole bunch of programs?
Well, and I'll get to you, Judy, in a second. It looks to me like we've already done that to some degree with the psych and then the Healthy Start. So, but I think you're right, Corey. Do we fund everybody but at lesser amounts, et cetera? I would like to present something to the board that do have a program. Go ahead, Judy.
Well, I think Susan had her hand up too. Susan?
Yeah, what I'd like to see, I have two comments. One, I would like to see the ones that the embedded schools that we currently fund currently in 20 to be added into that number to be funded, just so we see where we're at instead of looking at before we look at new schools or whatever to decide on how that works. And then Mike, I have a question on the Bloomington High School one, because it was 20,000 and then but it's only 5 months and they're still asking for 20,000. So I'm kind of, should that number be reduced to be really a 5-month number like the one for Bloomington Junior High, which is the last part of this year?
Corey, didn't you say you thought maybe they just had flipped that they really aren't asking, that the lesser amount should have been for Bloomington High School, and the Bloomington Junior High, I think, is new, isn't it?
Mm-hmm, it is, yes.
The Bloomington Junior High one, that one got funded. Which is
In
the one that got
19,
funded in the middle of the year?
FY19, we funded it in FY19, but not FY20, BJ.
Okay.
And Bloomington High School got added when remember when we had held one off and we added it later in the year. So yeah, so I believe that is the one that should be in the amount of 8,333 instead of 20,000.
Yeah, I wanted to clarify. Yeah, I wanted to make sure we clarified that. And my other comment is I think we need to be very careful about, yes, we have used reserves in the past to add some money to that. It already is budgeted for next year to have that. And I can't remember exactly how, is that 50,000 each? Amy, we did the budget, yes, this week, and I can't even remember what it is now. Because this is like my 7th meeting this week already. So I think we have to be really kind of careful on what we actually go into reserves for because of COVID. And I know that even the Board of Health, when we met this last time, we are funding positions out of reserves and moving money out of reserves to do things because of COVID. And I kind of want to, I know we have them there, but I think we want to be kind of careful on that to make sure that if we do that, something becomes sustainable very quickly, because we wouldn't want to continually every year then continually do that kind of thing and not having it be sustainable. So that is just kind of a cautionary type of thing when we talk about that. And that's why when Hannah mentioned about figuring things out based on what's budgeted, and then maybe next month go and think about if we want to do anything else. Once we get a better, feeling for what's around and what's going to happen and stuff.
And, Corey, I think in passing, you made an interesting comment, and this is something to throw out to folks. It's been something we've talked about. Everybody has charged indirect costs in their applications. And, we have said we would pay for indirect costs, but I think it does come down to, at some point, if we want, we can certainly negotiate with folks about their budgets. If we're looking at trying to free up more money, is that something we want to look at? Is saying, we just can't do this. And, there's probably money enough, $98,000 in indirect costs that could fund the Oz project. So just throwing that out there. But so getting back to the spreadsheet, it looks like if we looking at what we're proposing and maintaining what our current embedded school programs, with, I guess, the Fairview Sugar Creek being questionable whether that is actually ongoing, that leaves us about $38,000 to distribute across these other 4 schools, right?
I would, okay, so what we funded last year for those schools is Olympia, Unit 5, Kingsley Junior High in Oakdale, Unit 5, Parkside Junior High in Fox Creek, Bloomington High School, and Fairview and Sugar Creek, which never really got off. So I guess I'm right now reluctant to do Fairview Sugar Creek, because I just don't think we've proven that that right now is something, until we can figure out a way to make that work without, they're going to tell us unless they get $60,000, they're not going to do it probably. So I wonder if we should just take it off the table. And then I would go with, I would add, if we're going to stick with 5 entities, if we can even afford to do that, I would add Irving and Sheridan into that mix because of the significant need there.
Mm-hmm.
And if we need to take off something else, the problem with this is, like, we almost need to give people a heads up to give them time to figure out, how they're gonna make it work. And that's another thing. Do we need to, like, start doing that with any of these, to say to them, this would be the last year we would fund you, or we're going to fund you half of what you ask for, almost one of those, because some grants do that, where the last year of the grant, you get lesser money, because the idea is you're supposed to be moving more and more toward sustainability. And I realize this is a year with all of the COVID costs hitting every entity. This is not a year to say to somebody, well, you should be picking this up. But I think we also need to have a longer view of the school program, because we've said all along, we can't fund every school. And so, how do we decide, do we fund them for 3 years until they get up and established, and then we start saying to them, or we fund them for 2 years and then say, year 3, we give you lesser amount, and year 4, you're on your own, or, whatever. And this might not be the time to do that, but I think we have to have a longer view of a bigger picture model for how we're going to fund schools going forward.
If I might, Corey, I think that's that's a good suggestion, because we've talked about wanting to do this, but yet not wanting to create the impression that we are going to be able to do it every year at the same amount. And so by suggesting a plan, perhaps like what you are suggesting, is it would give them a heads up that this is something we are committed to, but you also have a level of commitment that you have to initiate down the road. So there isn't that expectation that every year there's going to be funding.
Susan,
Yeah, I'm gonna echo some of that. Because like if you look at Olympia, it was one of our pilot schools, so this is like the 4th or something year. And I know that last year, a couple of years ago, they hired a whole bunch of people and to work and do this on their own. And so we're still asking for the same amount of money that they have had in the past. And so that's one that I'm more curious as to know more about what they've done to address that issue, because if they hired 3 or 4 people several years ago, we should be decreasing our need, or the funding for them, because they are then making it more sustainable for them. And actually some of that, I can talk about Unit 5. I know they hired a whole lot of people too. And so I'm kind of concerned about that longer term, like Corey said, and I guess kind of weaning them off of our funding, because this was a pilot, and one of the things that the intention was to show them how to make it sustainable. Obviously, when you look at Ridgeview that Chestnut was in, and I believe they're still in there, is that they found a way to make it sustainable and have that embedded counselor in that school sustainably. And so they don't have to ask us for funding. And so, and I think that we really need to make sure that we explore all those avenues, because otherwise we're just going to continue to be in the same rut that we've been in for years on doing this. So I guess I'd like some, maybe more information, Amy, on things like Olympia, and even on the Unit 5 when they've hired people.
Susan, real quickly too, like in the applications, I don't know about Unit 5 as a whole, but in the applications, each of the school districts put how many behavioral health staff they have, or clinical staff. I don't know what they call them in the schools, but like the guidance counselors, social workers. So as far as Olympia, just going off of my memory of reviewing their application, it was pretty.
I got it right. Amy, I got it right here. It says, as the elementary and high schools do not have a dedicated social worker, and they have, so that gives them the ratio of 900 students to 1 counselor social worker at the middle school, and the limitations of their time dedicated to behavioral. So Susan, I don't know, you're saying you understand they got a bunch of staff, but they certainly are not reflecting that in the application. They're saying they basically have 1 social worker for and again, I'm guessing that would be contracted with Tri-County. You know what, I wonder if that means, see, that's what we need to know, is what the contract with Tri-County Special Education Association is, because they would be providing some supports through Tri-County Special Ed. But then, so we probably do need more information, but right now they're saying ratio of 900 students to 1 counselor / social worker.
And see, that's where my confusion comes in, is because I remember a couple of years ago, they were so into this program that they hired people to be sustainable. And I also know that the same thing with Unit 5, they hired like 7 or 8 people. And so I guess that's where I'm kind of trying to make sure that we're the payer of last resort on this kind of thing. And so that's where I guess what their application says and what we've known from the past are 2 different things. And so that's where I wanted some clarification on.
yeah, I mean, I think we had some discussion once about reframing how this application came in and asking ROE or the school districts to really be the applicants, so that they know where the resources are needed and they might be able to get some efficiencies out of it. But but we have what we have now. And I guess the other point that I thought is we get asked for the same amount of money. I know we don't have those third quarter reports yet, but again, looking at what's going on this year by itself, I mean, I don't know how many students they're seeing. They say 75 is just like they just, for all the schools, except I think Irving or Sheridan, they project 50. But I don't know what they've hit on their targets. And I agree, Judy, I think we need to look at this. And we had Adina Myers do that evaluation 1 year. Is this something we ought to look at again down the road to get her back now with a few more years under our belt to say, are the outcomes there? And,
If you read the quarterly reports, Hannah, the outcomes are there. They meet the objectives. We've made them really hone in on objectives, and they have to show that there's movement in terms of client progress, and they do meet those targets. So, I'm a little hesitant to spend more money on an evaluation because our quarterly report should tell us whether they're meeting the targets or not, and they are. So to me, it's more just what do we need to do in terms of, is our role bringing on new schools so the relationships get established, and then once they have a relationship established, we take ourselves out. I don't think it's a matter of, that it's whether we should fund them because they are or are not working. I think we've proven they're working. It's really how do we want to, is our role to foster the development of the programs initially and then wean ourselves out, or do we pick a few really, really, really high need schools and just assume we're going to continue to fund those because they are the most critical? And if we do that route, I think we definitely need district input, because they would have to tell us which of their schools they're deeming as, like the ones that are most under siege, even with district resources available.
yeah, Judy.
Well, and Corey is getting to an important point. We, I believe at one time talked about, wouldn't it be great if we could be in every school in the county in some degree? But we haven't discussed how we could ever accomplish that. And the big question in my mind, and part of the reason I had suggested that we not continue funding Olympia, because as Susan has also remembered, they did hire some additional people. So where are any of those additional people? And again, we don't have that for right now, but for the future, we need to know what kind of behavioral health services they already have in place in the school, in addition to the embedded person, because Unit 5 did last year hired a number of people with social work background. I don't know where they are. Are they impacting any of these schools? And I don't know, Amy, if we're in a position to actually look at any of that this year, or if that's something we need to make sure that we incorporate into our asks for information next year. But we're at somewhat of a disadvantage now. And just suggesting that we look at our reserves, I believe we need to be cautious about that, partially because, as Susan said, COVID, as well as we've been encouraged to really seriously examine our reserves and try to apply them to some of our programs. So we need to make sure that if we do that, are we doing it in a way that it will have to be sustained then with by something else, or do we have enough of our reserves to, in fact, meet another crisis, should we have one? So I don't know, Amy, if you think we can get any of this information we're alluding to in terms of who already has people in the schools and what they're doing, or do we have to wait for next year for that one?
So just
And then-
real quick,
Amy, just one moment. I'm sorry to interrupt you, but I see the time and I know Susan has to leave at 1. So just hold that thought if you would. And just kind of to recap a minute before you go, Susan, is it sounds like what we have gotten to is that we're looking at we're down to basically kind of distributing funds for embedded schools, at least at this go round. Is that kind of your understanding, Susan? Are you comfortable with where we are, that the spreadsheet that's up here shows what would become our recommendation, and we have to fill in the blanks to use whatever funds are remaining to distribute across the embedded schools? Does that make it?
Yeah, that's pretty much, I agree with what we have here, although I still question Olympia. And I would, if we add a school, I would say yes, Sheridan and Irving. To me, if that's, because if you're looking at the bottom line here on how much we have left, that would be one that I would definitely agree to fund, even though we're, new this year.
My only question on any new program is the same thing that Corey mentioned with the Fairview issue, is that COVID hit and these kids are not necessarily in class now. Are we going to encounter the same problems in those schools?
Actually, I believe Olympia's been remote or been in person since day one. I believe they started in person. I'm pretty
Talking
sure.
about 87.
And
schools.
well, and 87 is going to start, I believe, in another couple of weeks. And those schools are the ones with the highest low income numbers, which I believe parents probably need those kids back in school because of them needing to go to work and things like that. So I think that they could probably start out, with some good progress at the beginning there. Plus, if Sheridan is a community school, I think that they can work with the people from the baby fold that are there for the community school to then have those referrals right away from people. So I think that's the one that would be my highest priority of the unfunded schools that requested for requests.
Mhm. I agree. Hannah, before Susan leaves us, if I could go back to leave the embedded schools discussion for a moment. Susan, you had said, and I think we've agreed to fund psychiatric services for CHS at the last year's figure. However, I would like for us, when we get into that negotiation and that contract, to allow for some documentation of unmet need. And that might be a very good spot to expend some reserve dollars. If in fact that 400,000, and they'll define for us who they will be able to see, because they want to see a certain population. But I'm also concerned about the unmet need. And if we have reserves, I think that we ought to seriously consider in that spot helping to serve the needs of folks who need the psychiatric follow-up, who have no capacity to pay for it. And so I think it's incumbent on us to take that into consideration.
I would not consider using any of our reserves for that until I saw some financial statements. And I know that COVID has postponed some of the financial statement due dates. And so until I see financial statements from some of these agencies, I would not necessarily recommend using our reserves until I see their financial statements.
And I think there would be a number of factors, Susan, going into any consideration. But I'm focusing on this as being a significant need in our community. It's been elevated and raised in the media for community discussion a number of times. And I just wanted to make us aware and to underscore that if that need is there, and if there is the kind of documentation we feel is appropriate, that's one consideration. I'm not saying we should automatically do it, but be aware that the 400 probably will not meet the need as it exists.
Well, I would like to see that need, not just from CHS, but also from any entity that sees that makes referrals for psychiatric services. when they get turned away. I would like to see what that true need is for psych. I mean, and we know that there's more need than we could ever fill, no matter how much money we have. You
Agreed.
know, that's just the way it is in this nation with lack of psychiatric, care providers. And so I would like to see how big that need is, and not just through one agency's eyes.
Well, and exactly, good. And that might be a smaller piece of this and this committee's responsibilities to kind of come up with a mechanism to do that very thing, because we now do have the triage center. And is that in some way going to reduce that need for people who need that kind of follow-up? So I'm just putting it out there for our consideration, but I think we kind of maybe put it aside as a special research project for us.
Well,
It
and to
sounds
follow
me-
up on your comments, Judy,
Hmm?
one of the things, I mean, one of the reasons I was sort of on the fence on the Chestnut TCM is that we aren't really funding case management here. We're funding the
Okay.
psychiatric and we're funding crisis response.
Right.
And within those, there should be something that, and I think case management's an important piece to keep people stable.
Mhm.
And the test I think was too limited in terms of focusing only on the CRU. I would say that we need to also look at the mobile crisis unit to ensure that because they have counseling services available at that agency, that there is some movement back and forth between their programs so that a person in crisis then is referred for case management within CHS. And they haven't asked us for funding for that particular program. I know they have it.
Mhm.
I think so we don't really have specifically funded case management out there. And I think it's for future discussions, but we may want to look at trying to encourage, by pulling our different responders together, something, whether maybe that's something we look at in-house even. But anyway, so
All good points. Thank you.
yeah, Corey.
I'm thinking we should spend the next half hour generating, if we need additional information to nail down final recommendations, what are those questions and who are we asking them to? I think that's going to be really important that so we set ourselves up so when we meet again, we'll have the information we need to make, solid decisions. And I
Let's
will-
do that. Point in terms of the time frame. Do we want to decide that we are not prepared today to make a final recommendation to the board, and that what we want to do is find a meeting time in November or the next few weeks, and then, yes, you're right, Corey, to say what we want to do to figure out how to handle the embedded school funding. Is that where I guess Susan's gone now, but is that what you guys feel comfortable with for today?
Well, yes, and then my other question is, should we consider the concept of possibly not paying administrative costs? Should we do the math on that and see if that gets us anywhere that it's worthwhile? Or again, do we need input from the entities to tell us whether that would be, would kind of jeopardize their whole
Exactly.
proposal? So, do we even want to entertain that? Let's maybe go through all the open variables we've got and eliminate, either ask for more information or eliminate them. And so one of them is obviously administrative costs. One is reducing the amounts of some of the requests. One is, looking at in-district behavioral health supports, even though they've already given us that. And I would add, just to give you an example of why deciding how many staff they have is difficult. Because for example, Olympia, that we're paying for the embedded therapist to service the entire district. So that's 5 schools. So everybody else is asking us to fund 2 schools at a time for $20,000. Olympia asks us to fund 5 schools for $20,000, and their total population is 1,000. I just had it here. It's the biggest number in terms of who we're covering. It's Why am I not seeing it? I'm looking.
Your point is well taken, Corey, and
Yeah,
it's
so we
mine
need
as
to be a
well.
little Careful, because again, sometimes we just, their total population is 1,826. So that's really, really big. And that, matched only by, like Bloomington High School is 1,490. So it's almost, 300, it's, yeah, more than 300 less. So we have to just remember, we're not exactly having equal units of measurement.
Right, which is a problem because I think everybody's asking for the 20,000 and showing on their budgets that that's about half of the salary of a therapist. So they're all finding half from other funds. And yes, they're seeming to be serving very different numbers of kids with the same cost. So.
Right. But I think it's how
know,
they divide. I don't think it's more staff time. I think it's how the staff then just has to be at different places a smaller amount of time if they're covering 5 entities versus 2. So they can't be at any one place that long when they're covering five schools. But I think it's still just one person that they're dedicating.
Mhm.
So
Judy,
anyway.
did you have a quick? You had your no. Okay, so I think Amy, I think what Corey's, and I agree, Corey, let's get our ducks in a row here in terms of at least looking at what the indirect cost would be. I don't know. I mean, I think with any of these, we kind of come down to maybe a set of finalists would be my way of describing it. And then we need to get our pencils out and look and see if there's any way to whittle down some of these budgets. And, it may be, looking at the indirect costs of saying that we'll give you 5% versus 10%, Yes, ma'am. Judy.
Are you suggesting then that we look to fund all of the embedded schools we had done before with the addition of Irving, and that we do not fund Fairview? Is that kind of where we are in the calculation?
And I have a question about the Fairview. I understand that Chestnut did not get it off the ground. And we haven't had a request from another agency, but I was trying to find my report card. Corey, you probably know at the top of your head, how does that particular school look?
Fairview and Sugar Creek together equal 769 students. Their low income level, Fairview's is 48, Sugar Creek's is 57. And I will say, like, Cedar Ridge's is 74%, Oakdale's is 68%, Bloomington Junior High is 61%, and of course, Irving and Sheridan are both in the 80%. So while Fairview and Sugar Creek, again, very worthy schools of service, I think, but I mean, if you look at the numbers now, the junior highs attached to some of those elementaries that we've been funding only have like in the 29 to 33% low income. But again, if you compare the elementaries, it's both Oakdale and Fox Creek are in the 60s, and Fairview and Sugar Creek are in the 40s and 50s. And Sheridan Irving's in the 80s.
Mm-hmm. Exactly.
My thought would be that we look at maybe not funding Olympia to allow us to fund BJ, Evans, Cedar Ridge, and Sheridan Irving. And partly, I mean, putting one person in that huge sea out there, it's better than none, but, and that might be part of the information we need to get from Amy is just I know when they've made presentations, some of the schools have had embedded therapists that are not paid by us. So I guess that would be the one question, is certainly knowing whether they have other folks there already and being paid. And of course, the payment thing could go all cuckoo because people have lost their jobs and don't have insurance anymore. So we don't know whether or not, in truth, it's going to be harder for them to bill for this.
So do you
Don't
think
know.
we make a list of our top like 6 schools and then have Amy and her crew get more information? Is that what you're suggesting?
Sounds like that's what we're wanting.
Okay. Are there
Yeah,
any
I
we're
would
gonna, are there any we're gonna fund for sure, so we don't feel like we've got to ask for more information? Like, are we gonna for sure do BHS and BJHS?
Well, let's see now, the yellow are the ones that we're funding, we had last year.
What we
And the
funded last year was,
or,
we currently we're funding, we already talked about Fairview Sugar Creek. We're funding Olympia, Kingsley, Oakdale combo, Parkside
Yeah,
Junior, Fox combo.
Yeah, I see it. And I guess what I would think is, how do they look this year in terms of staffing levels and et cetera? That, if our point is to give you a leg up and we'd like to move on to other schools that don't have it, then those that received funding last year, what's going on at Kingsley and Oakdale that,
Well, they did, the staffing levels are in the application. There's a whole section on, they describe who's in the school and what the ratio is of school personnel to student. So they do have that there.
well, I mean, I think there seemed to be some desire to have that information. If it's already in the applications and we don't need, I think, aiming to chase it down unless there was something else that I've forgotten that we were looking at.
Maybe we just ask Amy to pull that out and have it have it itemized for us, all in a row so we can look at that. So just have
Yeah, it
her
would be-
pull out this, yeah.
Just create a document with all those pasted in so
Yeah.
we can,
Yeah.
by comparison, look at
Yeah,
it.
that'd be good. So do that through the ones we're currently funding, except for Fairview Sugar Creek, or you want to do Fairview Sugar Creek for that too, and then Irving Sheridan?
I think we ought to look at all of them and,
So do it for everyone that applied?
yeah, I mean, it's just a matter of
Okay.
pulling that up, applications and posting them into another
Sure, okay.
document. So I think
Okay.
we ought to just take all that in. I mean, they're all applying anew or for the first time. So do we want to try to, Amy, what would be our normal November meeting date?
It would be November 2nd.
Okay.
Didn't,
Do you want to wait that long or do you guys want to try to come up with a different date?
I think we should do
To
it
me-
sooner.
yeah.
Also, real quickly, just going back to the two that, as of now, looking at refunding less than they requested, Healthy Start and MCCHS Psychiatric Services. I know last year when we talked to a couple of agencies about looking at less, we a request back to them to provide us with an updated budget on what it would look like if we were to give them less and how their output or their objectives would change. You want me for the next meeting to reach out to the Baby Fold and CHS and say that it's not approved or it's not decided, but the board is discussing possibly looking at these amounts. How would that change pieces? How would that change your budget and your outcomes?
I personally think that got really super messy last year and would not favor doing that, but I'll listen to you guys.
And
I
I would
think
think
we have-
last year, they'll just tell us they'll serve less people. I mean, CHS told us they would just serve that many less people. So, I mean, I
Mhm.
guess Amy, I guess it comes down to, again, if they can tell us how much per person the cost is, and which they've kind of already done, I don't know if maybe another thing that would be helpful, Amy, is if you would just pull out the administrative indirect costs on every one of these applications, except for the ones we've already, completely taken off the table, and just have a chart that just has the indirect costs listed. That might be helpful too.
I can definitely do that. And I agree with Hannah and you, Corey. I can look at what they have in their budgets for the indirect costs. I know I can tell you right now that the embedded schools for CHS, they don't have that 20,000 is strictly salary. There's no indirect costs in that budget. But I know there's indirect costs in the other budgets that I can pull out. I guess my concern is that if you guys decide to move forward, especially with psychiatric, that's a huge difference from the request, that at some point there's going to be discussion on how many will actually be served with 400,000 instead of the 551. And so I just wanted to make sure that that went through the board and that wasn't something that was left loose.
Yeah, and I think that what we need to do before the next meeting is look carefully at these budgets. So we could see with, I just looked at the baby fold, for example, and they have about 75,000 for staff, and then there's some other costs, one of which is travel. Well, in my mind, with doing virtual, you're not going to use the travel money as much as you might this year. So that may be an area where, okay, it's fair to cut. I think we need to do that first. And, we haven't done a fee for service with CHS. I just think that we didn't get really much of anywhere in those discussions. I think we need to decide, and we understand certainly what the consequences could be of giving less money. But we have to look at what our reality is, which is we have other programs to fund as well. And if that's what is the consequences, then that I think goes to some of the discussion I think Judy raised in terms of we really need to work hard, put a steering group together to figure out how to deal with this unmet psychiatric need. If this organization can only do X amount with the dollars they have in hand, then how can we bring more psych services to the community? And where's the money going to come from to pay for it? I mean, to me, that's where we go with that.
Do we also need information on what percentage they're currently doing services remotely versus direct, like in person? I think, because Hannah, you brought that up several times, thinking that, well, if they're doing it remotely, then it's kind of a different animal than before. So I think it would be helpful, Amy, if you could have them just give us a percentage of what percentage of their services are being delivered in person and what percentage of their services in these programs are being delivered remotely, and where do they see that going forward? Because that could go back and forth. That's the problem.
Well, and Corey, are we concluding then that that there is a difference in the cost to deliver the service remotely versus in person? And if there is, what is that difference?
Yeah, I mean, I think one of the things we have to be careful of is we have a process here and we can't start talking to these applicants. We have to be very clear about how we do that. And I think if we want to ask the embedded school applicants, we need to do it very formally with a written communication to them that says how many of these are, and we have our reports, and I don't know if our reports of the current recipients indicate what's being done remotely and what's being done in person. And I've looked at those quarterly reports, but they're not in my mind right now. So I think another thing would be we will have to, we don't expect to get the third quarter for them till the end of the month, right? Amy,
And-
I'm sorry, I'm asking you.
Yep, correct. And as far as what Corey is talking about, I'm not sure if they even track how many are remote versus in person, because I don't know within their world if it really makes a difference besides what Hannah, you were saying, less travel. But the other thing too, as far as like the quarterly 2 reports for the 3 active embedded school programs through CHS, because reminder, Bloomington High School didn't start until August 1st. But they served anywhere between 40 and 64 kids between quarter 1 and quarter 2. So I know that was asked earlier also.
And I do know that some of the embedded therapists saw kids all summer. I mean, they literally physically saw them because they were able to engage in activities outdoors and those kinds of things. So I think, I guess my point is that I'm just trying to be careful that we don't make assumptions that everything is remote and therefore, it changes who they are and how they're functioning, because they didn't go strictly remote in most cases.
Well, we have to rely on what they wrote in their applications too. And so we need to, I think at this point, what we need to do is stay within their applications and look at the monies we have available. And not try to bring in, unless we want to invite them in or have another go round, which, you know, we've done in the past, or a couple years ago, we had them come in. My problem with that is we get caught up so much in, and this sounds terrible, all the wonderful things about the program, which we know. And those things don't produce the kind of answers to the detailed questions that we need to make differences. But
I think we might be better off to prepare like a list of written questions, and like you're saying, Hannah, just have them submit answers to the written questions. So everybody gets the same exact, you know, question and gives us the response to it.
Well, and
Yeah,
to
Judy.
look, you know, clean and appropriate and transparent, I think, you know, it's prefaced by following our review. This is what, you know, so that there is an understanding that we have very carefully looked at what they submitted per our requests. And now we have some additional information we are requesting, because it got a little messy before, and we don't want to create the impression that we simply are not consistently asking for what we think we need to know. We need to acknowledge what has been given us, carefully ask for things that they did not provide.
And they provided a ton of information. I mean, when I read through these, there is a ton of information. I'm sure now, granted, some of the embedded schools, they were able to do the same thing, but some of the other ones, you know, and even the embedded school one, it was carefully thought out, you know, they were carefully thought through. So there's a lot of information there.
Mm-hmm.
Well, and in answer to your budget question, Amy, I don't object if we wanted to request to invite all applicants to provide a reduced budget. I mean, we could certainly say the total of dollars requested far exceeds what we have available. And, you know, if you wish to, you may submit something. I don't know whether you say a 5% reduction or whether, you know, of course they can have heard what we've said here, and that's fine, you know, but everybody could have the opportunity to submit a new budget if they want to.
Mm-hmm.
Open it up. What do you guys think about that? At least it gives them some opportunity to.
And
I
you're
like-
saying everybody except the ones we've taken off the table completely, right? You're not suggesting the ones we're probably not going to fund. That just seems that seems mean to make them do more work to tell them we're not going to fund them.
No, you're right. I think we said we went through and we see what that we can't fund this year. We have now we still need to narrow the gap, and or we can just do it ourselves. We can just look at it from our end and say, this is what we think we can do.
The thing about them
Which is-
doing it though is they can really figure out what, you know, they know everything, every piece of it, and we don't. So I mean, I'd almost rather they did it.
Right.
And then my other question that we haven't thrown out, you know, would we ever shave off any money off of Recovery Court? I mean, if we're asking everybody else to submit a reduced potential, why would we not do the same thing to Recovery Court?
Well, and I don't know, Judy, you look like you're thinking. I have this comment, but I'll wait if you have a thought. Or, I mean, where I'm taking things right now is that we had a budget presented to us as the Board of Health, which we approved, and these were the numbers that were in those. So I'm today thinking we're working within that approved 1.14 million that we have.
We have,
Obviously, there are questions that can be asked that go beyond, that would go to changing the budget for this particular entire program, which might either say, maybe under these circumstances, we think the allocations are not correct, or are there funds to bring in? I mean, another question that in my mind is saying, we don't ever act like the sales tax money and this money work together. Another question that could be asked is, are there surpluses in that sales tax fund that could be used to help support and ensure the continuation of these other programs that we're looking at, which is a so, I mean, but I think where do we get extra money different than, I think go through the hard work today and next time. Just the reality, if we have this much money. That will lead to probably further discussion on whether we need more money, but
Well, and that, yeah, you're right. And that also then would suggest that we had put in our budget the 209 for court services, that's where we are. If we add up those programs that we feel are legitimately, and we will be looking at funding, and that means we've excluded several. The difference between that and what we have available might help Amy come up with a percentage. And I think it's okay. I believe United Way used to do this and others would do this, that, you know, that this is how much we have available, and we're asking you to consider your application in light of a reduction by whatever percentage, you know, and they all have that opportunity, so that we in fact honor what we put in our budget.
I just want to give the group a reminder that there's a hard stop at 1:30. So we have 10 minutes. And I know you guys want me to collect some information before the next meeting. So if I can have, towards the end, if I can have a few minutes to make sure I know exactly what you guys want me to collect, that would be great.
That very
Yeah.
good. Thank you for that, because we're all over the place, right?
well, here, I think the thing we need to do in the next 10 minutes is decide when our next meeting is. And we unfortunately don't have Susan here. Maybe I could text her, but you know, we do have a kind of a reserve date on November 1st. You said, Amy, right now, November, what was
November
our,
Monday, we have the reserve date on Monday, November 2nd.
I don't know that, do you feel that, and then our Board of Health meeting would be not the 11th, that's Veterans Day?
We're doing it on the 18th in November. We've had to change
Right.
it.
So that gives us an extra week. So I don't know that we can't wait till the 2nd if we're going to ask our applicants to resubmit new budgets or revised budgets. And, you know, and look at some of the, I'm just suggesting that, but I'm open to an earlier meeting date if you guys want to bump it back.
Now, are you suggesting that we clarify for Amy what it is we are asking her to gather for us, and that we consider that on the 2nd of November in anticipation of a recommendation to the board then on the 18th?
Yeah.
Okay. Mhm. And Amy, in terms of decisions not being made until the 18th, does that compromise the schedule that you are using and have distributed to our applicants?
I don't think so.
Okay.
I know it definitely isn't ideal or pushes it back, but no, I'll have to have the contracts ready for the approved applicants to get those executed, but no, it will be fine.
Because that's a process, I think, for a lot of reasons we don't want to jeopardize. It's just too important.
Yes.
And
So
let me,
now I want to take the time to clarify for Amy what it is we'd like her to collect for our review on November 2nd.
yeah, I think that what I think is that if she would produce a document for us that takes the staffing levels for all the school applicants into one document so we can easily compare. I don't know if there's a spreadsheet
But
in there or
remember,
not,
that's
but
going to be difficult because every school, there's such different sizes. I mean, that's kind of a problem unless she does it by, you know, student, like
we could have,
support person, student ratio or something. I guess she'll have to do it that way.
So the contract, I can easily copy and paste say that the contracts, or excuse me, applications were written where it said X amount of staff, and then it would be like 1 per 300 kids. That's all in the application. I can easily pull it.
I mean, I think we have to work with what we have from the applicants and, you know, understanding. I think, Corey, thank you for making it clear that if they have, I mean, I think if they have embedded therapists in the school now, the ratio may be huge, or there may be a school with no embedded therapists. I mean, I'm looking at it maybe in a more crude level because I think not all of them have the embedded therapists right now. So going back to the question of whether the people who we think we would not support funding should be invited to submit revised budgets. I think we need to ask them as well because we haven't acted on those yet. We're talking about that, and I mean, I understand it's like, okay, but I don't know how, I was wondering whether we needed to take action today before we hit our 1:30 to have a motion that those, the eating disorder, the Chestnut Psych Services, and did we also have the substance use on that list of non-funded and act, include that as a recommendation?
Didn't we have Chestnut, the two programs? Or are we going, are they
Right.
be counted as well? So that leaves us with 5 programs that we've already, it sounds like have discussed, we are not going to consider.
Well, and I guess I'm wondering whether we should have a motion on the 4 that are in red now on the spreadsheet as being recommended for no funding for next year. The substance use, we have not a red mark there, but maybe we should ask them to go back to their drawing board on budget.
I would
the
like to
rest.
ask, I would definitely like to ask them to resubmit something because, but I think the four that are red, I think there's no, I think it's almost mean to ask them to do it.
Exactly. I mean, we've
For a
already,
motion. Let's get this done. What, we have enough to make take some action here. We have limited action, and we have that on our agenda. So I would ask somebody to make a motion with regard to the 4 that we have identified as not under consideration any longer.
I so
So,
move.
okay.
Second,
So your motion is that the adult eating disorder, youth and adult, the adult psychiatry from Chestnut and the target case management, we would not recommend funding for the 2021 fiscal year.
Correct.
yes,
You seconded that, Corey?
yes.
Okay, so you want to do a quick roll call, Amy?
Corey Tello,
Yes,
Anna Heisner,
Yes.
Judy Buchanan.
Okay. All right, with that, then I think we send all the remaining folks an invitation to revisit their budgets under the circumstances of where we sit. And if you don't mind, I would be happy to work with Amy on kind of looking at that number and communicate to you guys in terms of whether I think Judy had a good suggestion of, we're this short percentage-wise, so we want everybody to look at that percent in their budget, or it'd probably be helpful to give them guidance.
that would be great. That would be wonderful.
Go for
Can
it,
I
Dan.
ask a question, Amy? Amy, do we think moving this time frame back, I mean, because I know we're not the only ones that are worried about our budget. You know, I mean, this is such a weird year to try to get budgets put together and staff hired or calmed down. And some of this could be they will have to cut staff if some of these programs don't fly. So I'm wondering if we wait until, I mean, because we could actually take action at this board meeting, at the coming board meeting on October 14th, if we met earlier. But I don't know that the people could revise their budgets. But you know what I'm saying? I hate to drag it out for people a whole nother, you know, it's going to be almost another 6 weeks before
No,
they get anything finalized. What do you think, Amy?
I totally agree with you, Corey, that ideally they would be able to know this month versus, and then like you guys said in November, it's November 18th instead of November 11th. But I don't know how we could feasibly follow Open Meetings Act to have a meeting before next Wednesday.
How about we consider a board meeting? I wonder if we could do something earlier, and then I wonder if we could have call a special board meeting to decide earlier, because I do know, you know, just like we agonized over our budget this year, everybody's agonizing over their budget. And this is, for many of these, this is whether people are going to get laid off or not. So, you know, so we need to be cognizant.
Which one would you see layoffs taking place? I mean, I know that the
Project
healthy.
Oz, I think Project Oz, very possibly, because we're talking
would-
about personnel that go out to several schools. So I think we're talking about probably personnel there.
That's-
Even possibly depending on how many embedded schools we cut out, that could be some staff time at CHS, depending on how much we pare that down.
I'll let you guys know we only have 1 minute. and I think we're gonna be cut off.
Yeah, I thought Scott said he had a 2 o'clock. So I guess, Corey, I feel your pain, but I agree with Amy. I think it'd be difficult. And if we want them to give us some feedback on their budgets and, you know, we're just gonna have to suffer through this. So,
And we acknowledge that. Let's acknowledge that too. Mhm. That everyone is struggling, and timing, we know is important, but we want you to do the right thing.
Great, so
All
on
right.
my behalf, look at the revised budgets and itemize the school information onto one document for you guys to review.
Yeah.
Okay,
and why
perfect.
don't we, do the, you know, as our minds work on this more, kind of give Amy, just feel free to give her some more feedback in terms of any additional information that she can compile without interacting with our applicants anyway.
Okay.
And then I'll work with her on it, and we'll keep this moving forward. Does that make sense?
Yes.
And we'll meet again then on the 2nd, but I'm sure that there will be lots of information flowing between now and then.
Okay. Thank you.
Okay, at 1:30 exactly, do I have a motion to adjourn?
So moved.
Second,
All right, I don't think,
We have to do
yes.
the Hannah Eisner,
Yeah.
Corey Tello,
yes.
Ms. Judy Buchanan.
Yes.
All right, we're 1 minute over.
A lot of good work here, so thank you very much, and I know we all hate it in the sense of having to
Yep.
make decisions, so.
Thanks,
Have a
everybody.
good day, guys.
Thanks, Hannah.
you.
Thanks, everybody.